Okay, welcome back, everyone. Good morning, some of you, and good evening, some of you as well. It's almost 10 o'clock in the night time from where I'm joining at this time. So let's see here. This is going to be your class 3 today for the cardiovascular system, right? So those who are already joining since previously part 1 and part 2, so they know that in today's class, we are going to cover some topics, leftover topics from the cardiovascular, the one we're supposed to do it today. And then, of course, I also bring some questions for practice as well. So this is the main thing we are going to discuss. And the class should be, I don't think so it will take longer than 1 hour. I think it can finish within 1 hour again today. And then rest, everybody can study the rest of the weekend if your exam is coming very close. And some students I know who also wants to enjoy the weekend as well, because maybe your exam is not right now. But try your best still to stay consistent, study a little bit as much as you can. Now, without wasting the time, everyone, let's get started into. I'm just going to start sharing the screen right now. Let me know if you can see my screen or not. If you cannot see my screen, you let me know right away. Okay. So let's see here. This one. Aortic aneurysm, right? So this is the next topic in cardio. Now we have students maybe here who are joining very first time maybe today. And for them, definitely welcome to the CAPS nursing classes too. Just a quick message. We are covering cardiovascular system. So if you have not watched my previous 2 sessions, you can definitely watch my session later on whenever you have some time. And if you have any questions after watching those lectures, you can let me know as well. And this is going to be part 3. So I'm going to cover today aortic aneurysm. Okay. This is my next topic today. And I do remember I gave this topic as a part of homework in the previous class, right? So let's see who remembers something about aortic aneurysm. Okay. So maybe I'll stop this screen a little bit for now so I can see what everyone knows about aortic aneurysm. Maybe in a chat box, if you remember what it is, like a simple 1 word, 2 word meaning, or even if you remember any sign and symptom about this condition, let me know. So I know that you studied something a little bit today before you come for this class, right? Very good. Tessie says swelling of the aorta. Right, very good. Okay, anybody else? YouTube students, anything you know about the aortic aneurysm? Or any other student remember anything what it is? Okay, bulging or outpouching. Okay, very good. See, that tells me you guys are studying or not. Okay, so that's definitely, if you are a serious candidate, try your best to do some homework also. Why? Because when you're reading Saunders' book at home by yourself, you might feel difficulty. And this is your opportunity to ask your doubts and questions in the class. If you're finding some difficulty in reading the book also. So I can help you around in here. Very good. Now I can see a lot of messages here and every message is a good answer. So now I can go back to what it is and what we are going to do into there without wasting the time. So we're going to go back to this slide now. Okay. So here, very simple definition, I think, what is the aortic aneurysm is. It is an abnormal bulging, or you can say dilation. Where? In the wall of the aorta, right? Why does it happen? Because of the weakness. And why the weakness happen, I'll talk about very soon here in the risk factors and causes. But before we understand this thing, I think if you remember like a simple word, like a kind of story, then you can remember a lot in the exam. What is the aortic aneurysm, right? Quickly reminder before I tell you story, guys, those who are joining very first time here, I want to let them guys know as well, just in case if I leave the class for 5 minutes, just try your best to understand the situation because I do have like a family situation sometime with me. So I have to go and leave the room for 5 minutes. Okay. Then I'll come back again. In every session, I always tell I have a little baby. So I don't want to repeat that, but just try to understand. Okay. Because sometimes my little one moves around. I have baby camera with me right now. You can see how I'm teaching in the middle of the night, right? So basically, how you can remember now aortic aneurysm with a simple word, I would say consider aorta, as a highway inside your body. Imagine, just imagine, right? So you can remember this in the exam for a long time, or even when you go for clinical practice after that as well. So imagine like aorta is like a highway, right? And if that highway get weak down for some reason because of sometime, a lot of traffic is in there or maybe some other reasons as well, but it just get weak. And because of weakness, that road, that highway start bulging up like a balloon, right? So this is how you want to remember aortic aneurysm in the real exam, right? Now, this aneurysm definitely can be of two different kinds, right? The one we call thoracic aortic aneurysm, the second one we call the abdominal aortic aneurysm, okay? Those are the two most common ones, which I would say most of the time NCLEX test these questions, right? So everybody needs to know thoracic also and abdominal also as well. But what is the main reason why these aneurysms happen, right? The main reason why that your highway road is getting weak and everything, because of the first reason you can correlate atherosclerosis, right? So too much plaque formation is in there. Maybe it's too much dirt around in there, too much plaque formation that just make everything jam in the traffic. This is how you can remember it. Or maybe lot of traffic. So remember too much pressure there, maybe lots of like high blood pressure in the problem in the body. Or maybe this client is having an issue smoking since very long, right? And that smoking leads the aneurysm. Or maybe because of the age factor, person just getting older. Or it's also common in the males actually, rather than the female more. It also, I would say, also happen in females, but in the male, as per research, is more actually. But also, sometime because of severe infection inside the body, even some accidental injuries can also lead to the aortic aneurysm problems as well. Any of those, the one we said, thoracic and abdominal. Now, let's try to understand which sign and symptom you're going to look into your patient. When you have someone in the medical emergency department right now, how do you know that person has this kind of problem? And what are you going to do as a nurse is in there? So the first one sign and symptom is related to the abdominal aortic aneurysm, right? So abdominal aortic aneurysm, as you can see the photo for the reference on the side. So this is like the one we're going to talk about in here, right? And they also give you like a big picture of that. The first thing you will see is pulsatile abdominal mass. Means what? When you try to feel it, on the assessment, you can actually see this bulging mask is also like having like how to say, having like a more like a pulse. Like you feel like a pulse on the top of it, and that pulse is too high, moving around. I would say if I want to use one word as a Hindi language for some Hindi candidates, maybe because I think a lot of this request is coming a lot now in my phone. Ma'am, can you also please explain something in Hindi also? So I'll try my best sometime for all of you too. But majority of the students I know they're watching in English language right now. So just bear with me, only one word for Hindi as well. So for Hindi students like जब गांठ बांध जाती है ना आपके पेट में, जो जो वो गांठ होती है, और गांठ को जब आप ऊपर हाथ रख के उसको देखोगे तो वो पल्स आपको फील होगी उसमें से. So this is we call pulsatile abdominal mass, right? And for English students, I think you guys already understand what do I mean with the pulsatile abdominal mass, but you can always tell me in the messages right now, in a chat box, in also in the live chat on YouTube, if someone has a still doubt what it is. Bruit over the abdomen. Bruit over the abdomen means basically, when you do the auscultation with the stethoscope, right, on this mass, you will hear some sounds like a whooshing sounds, it's like shh, shh. It's like a fast flow of the blood, that kind of sounds. I'm just making as an example, but it's definitely a different kind of sound, but you can correlate with me for sure. So that one we call bruit over the abdominal area. Now, the third one we have is the deep, constant abdominal or the back pain. So patient will describe you. Patient will tell you like, oh, my pain is in the back is so much. It's so much severe pain right now. And also sometime it just continues. It's not even like stop at any point. Poor distal pulses in the lungs, in the legs. In the legs, you're not going to find maybe much pulses in there, right? Why you're not going to find the pulses in there as well? Because um, the blood supply is reduced now towards the legs, towards the feet. Why it's reduced? Because your aorta is swell up right now and blocking now the circulation much from one side to another, right? So definitely the downside in the in the legs, you're not gonna see much circulation is in there. So that's why poor distal pulses you're gonna see, right? And then you have gray Turner sign. Gray Turner sign means like around this area, you will see on the top of the skin of the patient, like this much, almost this much size, the one I just draw it right now, right? This much size, you will see like the skin of the color is also turning into the gray, usually more close to the flank region, right? And it's look like a more like a gray bruising something, right? If that sign you already see, definitely it's already bad indicator. Sounds like rupture is already happened. You need to watch it out now, right? One student asked me question back again on the YouTube. She wants to know back again for the bruit over the abdomen. Harpreet, bruit over abdomen means like you will hear some sounds. So that sounds we call whooshing sounds, right? So let's give you an example. Imagine I have an empty bottle in my hand, right? And that empty bottle, if I put too much fluid from outside, like suddenly, quickly, you will hear some sounds is in there, right? Similarly, in this aortic aneurysm, the abdominal aortic aneurysm, because of the dilation there, it's too much volume, right? So the sounds you will hear is there. That's more like a whooshing sounds, like too much noise of the fluid, the volume which is going into there. That one we call is the bruit over the abdomen in this case. Now, let me see. Another messages are in here as well. Let's see another messages. Bruit indicate the obstruction. Yeah, that indicate the obstruction also. And then Gray Turner is also assessed and diagnosed for the pancreatic cancer also. Very good. That's good sharing, Noman, this one, because this is Gray Turner sign is also common in that case as well. But if you see the Gray Turner sign already with some of these symptoms, that indicates the aneurysm also at the same point. Raki gave the example of the water pipe. Yeah, you can think about the water pipe in that case, if that makes maybe easy, right? So Harpreet, she said she understood. Perfect. If any other student also has any doubt, they can always let me know at the same time. So this is what you're going to see in the abdominal aortic aneurysm. Now, if I talk about thoracic one, in the thoracic one, you will see more. The patient is having usually difficulty in breathing, like more shortness of breath. And because of that, the patient also have a chest pain at the same time. And also like pressure more on the laryngeal nerve. So because of that, changing in voice also, like hoarseness type of voice and swallowing issue at the same time, which we call dysphagia. And sometimes maybe cough will be in there, but not all the time. Okay, so this is something you really wants to know in the sign and symptoms of the between abdominal and the thoracic aortic aneurysm, right? Now, what are you going to do as a nurses in there? So first of all, if the size of this mass is less than 5.5 centimeters somewhere, or you can say patient is stable still under that. So at that time, you just try to do some conservative management, like how you basically look into symptom and treat only symptoms basically in there. So for example, you just control the blood pressure if the patient has a high blood pressure. So your goal should be always to make it low and slowly, right? So low means back and close to the normal as much as possible, right? And don't push the blood pressure down suddenly. You need to basically try to slow down slowly, and you can do that by using the beta blocker medications as well. But we will discuss medications in our next lecture. So next lecture, everyone, because today we are wrapping up the disease conditions of cardio, which you must need to know for your NCLEX or for your NORCET exams too. But as I always say, if you find difficulty in any other topic when you're reading Sounder's book, you let me know. So I can always explain you more topics as well on the WhatsApp, right? But also in the next class, remember guys, I'm gonna do every single cardio medication, and I love cardio meds, believe me, right? Why? Because I learned cardio meds by using a story and everything, so it's very easy for me. So same method, I'll give it to you. So try your best to attend my next 2-3 classes for sure. That will be heavily only on the meds, okay? So now another thing what you want to do as a nursing intervention is if your patient is smoking, maybe they need to stop the smoking. So try to educate about it. And regular ultrasound monitoring is required because by looking at the ultrasound, we can confirm this diagnosis actually. And apart from this, no heavy lifting. Okay, this is what you're going to teach to your patient. Avoid like doing a heavy lifting because that will put a lot of pressure in there. And teach the patient also report the sudden severe pain. If something sudden pain started or a severe pain started right away, they need to report it to you until they go for surgery, right? So basically this is once they are until still stable. Now, usually these sizes go up really faster most of the time in most of the cases. So if you see the size of the mass is more than 5.5 centimeter, in those cases, we use the surgical things, right? So surgery needs to be required. And usually within 6 months, it just go a little bit up. So the doctor usually keep checking, by looking into the ultrasound. So this patient might need to go for some surgical. And or maybe if the symptoms just get severe or rupture happens suddenly, then yes, they need to go for that. Now, I want to talk about how do you know the rupture already happened. So I'm just going to read it from your book, the rupture kind of symptoms, the rupturing aneurysm symptoms. So in case you see these symptoms in case studies or in any question in the NCLEX or in your mains NORCET examination, this is actually going to help you a lot to understand rupture already happened, right? So severe abdominal pain or severe back pain, if you see it, that's bad. Lumbar pain, if you see from the client, that's something what the client reported to you. And also radiating to the flank region, that pain or the groin area, this is also bad. That indicates the rupture already happened. Or if the client already have a symptom of like internal bleeding happening inside, like the patient is having a high pulse rate right now and the low blood pressure and signs of shock maybe, right? Or maybe hematoma already at the flank area, the one I mentioned earlier. So this is what you're going to see, and that indicates the rupture is already there. Now, apart from this, when we're doing the surgical intervention, these ones are usually of two different kinds of the surgical interventions in most of the hospitals, wherever you go in the world. The one we usually call open surgical repair, and the other one name is endovascular aneurysm repair, which is less invasive. For NCLEX students, they don't ask you the name of the surgery and everything in the test. So if you cannot remember surgery name, that's okay. But you must need to know what are you going to do post-operatively for sure. Okay. So post-operatively, doesn't matter what surgery patient has it. So this is mandatory. The first thing definitely is monitor the blood pressure closely, right? So if it's too high blood pressure, that might indicate the bleeding is already like happening or rupture is in there in post-operatively. That's the risk for bleeding in that case. But if it's too low blood pressure when you check in the post-operatively, that could be a risk of the graft thrombosis, which they use it at that time in the surgical repair. The second thing in the post-operatively is check peripheral pulses every 1 hour. This is also very, very important because patient just went for surgery also. Now you want to check the circulation, right? And this is the other best indicator how it tells you about that. And also you want to check for kidneys function at the same time. So make sure it's not less than 30 ml per hour. If it's less than 30, you need to notify the doctor, the provider, the person who is taking care for that patient. And also the contrast dye from the procedure, the one we use for the surgery in the less invasive one, that can damage the kidneys actually. So definitely you need to monitor the urine for that, right? Because you want to make sure the kidneys go back to the normal and flush out all the dye what we use at that time. I already mentioned avoid heavy lifting earlier, even if you need to avoid the after procedure also. And after procedure, we usually recommended for 6 weeks because some sutures are in there and definitely they can get popped up at any point. So they need to avoid the heavy lifting for sure. And the last one we have is monitor for the graft leakage, right? How do you know the graft leakage is already happening? If the patient tell you post-operatively, nurse, I have abdominal pain, or if you see some signs of bleeding happening inside, like decreased hemoglobin, decreased hematocrit levels, right? Or maybe you see rapid heart rate, low blood pressure, as I said, the signs of also the bleeding inside. So if you see these some things, you need to do something in there, right? So that's all about the aortic aneurysm. Any questions, any doubt until here, please? Okay. Give me 5 minutes, everyone. I'll be right back. Okay. Thank you. Hi everyone, I'm back here, but I really apologize. We need to cancel the class from here today because my little one is actually up right now. So he's along with me right now. That's why my camera is also off. So he might gonna make some noises and disturbance in the class. So that's why I think it's a great idea if we only learn about this topic today. So when we meet the next session, we can do the questions, or either I'll send you guys this presentation and you can solve the questions for me and let me know the answers in the group and we can go from there, right? But I really apologize, everyone, not to make continue today because he's actually not kind of feeling well, and I did not even imagine he's gonna get up in the middle of the night. So I need to end up this class at this point. I hope you guys can understand. But thanks so much for understanding. Yeah, no worries. I really apologize. Yeah, he's with me right now. You might can hear some noises. Okay. Thanks, everyone. See you guys in the next class. Thank you.